My name is Kara Watts. I'm an Associate Professor of Urology at Montefiore Medical Center and Albert Einstein College of Medicine in the Bronx, New York. The difference between prostate cancer and BPH has to do with the actual condition. BPH is benign or non-cancerous enlargement of the prostate that happens in patients who are genetically male over time as they get older. The prostate only exists in patients who are genetically male. It does not exist in patients who are female. And it lives just below the bladder. It's a small gland. And over time, this gland slowly grows. It essentially grows your entire life. It never stops. And as it grows, it can cause some symptoms that may be bothersome to some patients as they are urinating. So BPH refers to the symptoms that derive from the benign growth of this gland over time. Prostate cancer, on the other hand, is cancer of this gland. And not all patients develop either BPH or prostate cancer. BPH is a lot more common. At least 50% of men over the age of 50 will start to develop some symptoms related to BPH or difficulty with urination. And in terms of prostate cancer, the frequency is about 1 in 8 over your lifetime. So BPH, as I mentioned, is benign enlargement or growth of the prostate. The prostate is stimulated to grow by hormones that are naturally produced in a genetically male's body. And over time, the prostate slowly grows, and as it gets larger, it can start to cause symptoms that are bothersome to the patient. The symptoms of BPH are a wide range. The most common that people can develop are what I describe as obstructive symptoms. And so these typically manifest themselves as a slow stream or hesitancy, which means having to wait to get the urine stream started, having to push to get the urine out. You may also develop a little bit of frequency, having to run to the bathroom a little bit more often, or urgency, which is essentially when you have a need to urinate, you have to run to get to the bathroom. Some patients may also develop a little bit of leakage of urine. And occasionally, some patients also see some blood in their urine from enlargement of the prostate. Blood can be related to BPH or to other symptoms, and in fact, all of these symptoms can be from BPH or other causes. So if you're starting to notice any of these and they're bothersome, you should bring it up to your medical provider or seek evaluation from a urologist. BPH is diagnosed by clinical symptoms and findings. There's no one single blood test or imaging test that can tell you that you have BPH. So we know that the prostate tends to grow over time and cause symptoms. So if you are starting to develop some of these urinary symptoms that are bothersome, your primary doctor or healthcare provider or a urologist will likely do an examination of your prostate, which may include a digital rectal exam to get a sense of the prostate size. They may also check how strong your urinary stream is. It's a test called a uroflow, or look to see how well you're emptying your bladder with a bladder scan. But mostly BPH is diagnosed based on clinical symptoms, your age, and a rough estimate of how large your prostate gland is. There are a lot of treatment options for BPH. It's actually one of the most common conditions that we as urologists see and treat in our practices. So the least invasive options are behavioral modification. So we typically start with trying to avoid things that irritate the bladder, such as caffeine or alcohol, trying to restrict liquid intake before nighttime to limit how many times you may be getting up at nighttime to urinate, avoiding constipation or things that may lead to constipation that worsen the symptoms. And then you may move on to actual treatments, which include the first-line medications, there's two groups of medications or drugs that we offer for these. One of them are alpha blockers and one of them are called 5-alpha reductase inhibitors. They work differently, and which one may be better for you is worth a discussion with your doctor. And then if medications are not enough, or you're not able to tolerate, or you prefer not to be on medications, there are a wide range of both minimally and more invasive options to actually reduce the size of the prostate. And this ranges from procedures done through a camera to shave open the prostate and reduce the size, or to place tacks inside to open them up, to actually remove the majority of the prostate through either a open incision or a robotic, minimally invasive incision. There's a lot of different options, and not all of them are appropriate for each patient, but know that there are plenty of opportunities, and you can certainly discuss them with the urologist. BPH does not technically affect a patient's sexual function. Sexual function tends to decline over time naturally, and at the same time, symptoms related to BPH tend to worsen over time just due to the normal growth of the prostate. So some people think that they're associated because they tend to happen along the same timeline, but the reality is that they're not actually related.